a data update. Then we will follow with Chris Campbell, giving us an update on where we are with vaccines. And today we are joined with our vaccine providers from around the county who are going to give us a little bit of an update on how to register and how their vaccine appointment process works for each of their organizations. So I will start by handing this off to Jeff. Jeff.
Thanks, Chana. Much appreciated. Thanks, everyone, for joining us again today. I am going to just go over a couple slides here because we want to focus on vaccine, and we've got our providers here, which we greatly appreciate. They are part of our delivery system, and we can't do that without them. So we want to make sure we spend adequate time in the area where we know most people have questions. So what I'm going to do is share my screen, and I'll just go through a couple slides here. The data is looking good. So we are past that point where we were not sure if we were going to see a spike associated with Christmas and New Year's Eve. And although we did see a slight spike in the data, we are not seeing anything significant. And our overall cases, hospitalizations, and deaths are back on a decreasing trend this week. And that's both here locally as well as across the state. It is really important that we continue to maintain at least 80% transmission control. And that's the fancy term that they are now using for social distancing. So as a comparison, when we were in the full stay-at-home order back in March, we were at around 75 to 80% transmission control, and that is where we are currently. It was a little bit lower the last couple weeks over the holiday, down to between 73 and 78%. But it is back up, and that is part of the reason why we're seeing decreasing cases. It is really important that we maintain that, as it's the most effective way to prevent hospitalizations and deaths while the vaccine is rolling out. That, along with masks, as I've shared with you in the past. And we know that it is also critically important that we use the vaccine to prevent the maximum number of deaths. And the best way for us to do that is focusing on that 70 plus population in the 1A and 1B above the line in order to accomplish that. So Chris will talk some more about that, but that is critical. That is where we're focusing. And we know that's going to have a significant impact on both hospitalizations and deaths as we roll forward. Go to the next slide. You've seen me talk about these before. I wanted to update you that we are at an estimated 1 in 114 people infectious this week. This number will probably go up again next week as long as our numbers continue to decrease. But again, even with the 1 in 114 people, we still have a lot of infectiousness in our community, as compared to 3 or 4 months ago, where it was 1 in 800 to 900. So we can't let down our guards. And again, 50% of the people that have the disease don't even realize they have it. We're asking you again, sign up for the exposure app, follow those prevention strategies that are on the screen. In no large social gatherings, minimize mixing of households. That really can spread the disease drastically. And so important to wear masks, good hygienic practices, and of course, keeping at least 6 feet apart. What we don't know at this point is what the prevalence of the new B.1.1.7 variant could look like later in the spring. So we are keeping an eye out for that. Just a reminder, that variant is more easily spread. It more easily spreads the disease with that variant. It's a higher transmission, but it doesn't have any more severe impacts, at least at this point from the latest information that we know. In addition, it does look like the vaccines are effective in controlling the spread of the variant as well. So just wanted to make sure everybody's aware we're headed in the right path. Please continue to be diligent. As vaccines are being distributed, we will continue to see our numbers decrease. I'll stop there and turn it over to Chris, who will walk us through where we are with vaccines.
Thanks so much, and good afternoon. It's always great to spend time with the community on this great forum. My name is Chris Campbell. I am the Emergency Management Coordinator with Boulder County Public Health, And additionally, I'm the vaccine lead in Boulder County. Been in this forum with you all for a couple weeks now, sharing updates on our vaccine administration in Boulder County. My update is going to be pretty short today. There's a couple things I'd like to share, and really want to introduce you to some of our partners that we're working with as vaccine providers in the county, and just let them share their story and how you can work with them, particularly our, as Jeff mentioned, our community members that are 70 plus. That we would like to really encourage to start to sign up for vaccine. Just more of a global update. So thus far in Boulder County, as of yesterday, we've vaccinated almost 17,000 community members with that first dose. And we are moving and starting to make progress with the second doses. So that's we've vaccinated about 2,500 with that full course, which is it's starting to move us forward and working towards that sense of normalcy and light at the end of the tunnel. So I just want to share that with the community about the numbers we're doing in Boulder County. Statewide, just to share with the group, we have vaccinated just about, in the state of Colorado, about 280,000 community members with that first dose, and about 50,000 community members with that second course. So again, we're making slow but sure progress. And one thing I wanted to additionally discuss, and just again, some full transparency with our community members. Our vaccine allocation, you're going to hear from our providers, is still been a challenge. We have 31 providers that have joined us and are able to provide vaccine to Boulder County community members. They have the capacity to, on a weekly basis, provide about 20,000 vaccines to the Boulder County community. This last week, our vaccine allocation was about 3,500 vaccines. So again, and I've talked about this in past forums, we're at that phase we knew would be likely coming, where we have a constrained environment with limited vaccine. And we want to make sure that we're ready as a community, getting all the information we have possible out with transparency to community members about where we're at. And we also want to acknowledge that the information has been challenging. It's been confusing at times. Early on when we made that shift and we heard some changes from the governor's office around bringing the 70-plus-year-old groups into the phasing, that was a big shift in our planning effort that we had to make, and that's been a little bit challenging given that we still have very, very constrained vaccine supply. So we recognize that, and we're going to keep sharing information with you on a regular basis. We also know, and we've heard feedback from community members, and we're going to talk more about this also with the providers that are on the call, that it's been challenging to figure out where to go to sign up for vaccine. So we are going to be notifying particularly a group of 70-plus community members that they will be able to go and sign up with the healthcare providers in the community. We would recommend, if you already have an existing provider with one of, or you have a primary care provider, or you have a relationship with one of the providers that are on our website, to please go sign up on that website. If you do not, we recommend that you go to one of those providers and sign up so that you can get on list and be in that queue to get vaccinated. So just some things I wanted to be transparent about. You're going to have more information. We know it's challenging that there's really kind of no single link where folks can go and sign up, and that's just not available yet. We hope to continue to work even on a national level and a statewide level to solve that issue. In the meantime, we're gonna put our providers up on our site, and you'll be able to go sign up with them when it's your turn in the phasing approach. So just a couple things I wanted to mention to community members that are joining us. So I'll go ahead and turn it over. We really want to hear from our providers. So we have providers joining us from Salud Family Health, King Soopers Pharmacies, Safeway Pharmacies, Boulder Community Health, SCL Health, and Clinica Family Health. And we look forward to hearing from them.
Thank you, Chris. So I'm going to pass it over to Boulder Community Health if you'd like to pop on and tell us about your system.
Good afternoon. I'm Jackie Atlasy-Priest. I'm the Chief Operating Officer and Chief Nursing Officer at Boulder Community Health. Thank you for the opportunity to be able to share our process with you for our vaccine appointments. So we are running a vaccine clinic on our Foothills campus, and have, of course, been focusing on the 70-year-olds and above for the last couple weeks. We actually have given over 8,000 vaccines to our first doses, and that does include, of course, our own healthcare providers. But of that, we've now given about 6,000 of those to our community members over the age of 70. We, as Chris mentioned, could continue to do more each day if we had the vaccine. So that has been our limiting factor. And so as we have tried to stay orderly and make it a good experience for our seniors to get in and out of the clinic easily and fast, we have a variety of ways in which to get an appointment. The best way to do this is through our website, so bch.org. There is a big front page that links you to the COVID vaccine, and there's a special area for those of you over 70 to go to. If you do have internet access and can set up a My BCH account, that is the easiest way. You do not have to be a patient at BCH to sign up for a My BCH app, and that is the easiest, slickest way to get an appointment at our vaccine clinic. The other way, by the end of the week, so by Friday, there will also be advertised on that website, so again, bch.org, an ability to be able to call a phone number, and you will be able to get an appointment and register through that as well. So those are the ways that we can. Obviously, if you're a patient of BCH's, you likely already have been invited. But if you have yet not set up a My BCH account, you might not know that. So again, that is the easiest way to be contacted and to get an order whereby you can go in and receive or get access to our appointment scheduling system. We have about 650 appointments per day. So there is a lot of availability. As long as we continue to get vaccine, we'll be able to actually grow. We can probably do 1,500 a day, but right now, again, our limiting factor is the ability to get vaccine to our clinic. So I think that is, I'm happy to take any questions, but that is our process.
Thank you very much, Jackie. Can you say how long your wait list is? Do you have a wait list?
So we do not have a wait list. So we just have appointments that may go out further. But if you're 70 years old or older and you live in our county, you will get an appointment. It just may not be next week. It may be later into February.
Thank you.
Mm-hmm.
That's really helpful. Thank you so much. I decided, I guess I'm going to go in alphabetical order. So I believe Clinica Family Health, Simon, are you ready to share?
Sure. Can you hear me?
Yep.
Great. So thank you. And I just want to start by saying, a big kudos and thank you to folks from Boulder County. This has been an enormous effort, and I think it's just worth acknowledging what Chris Campbell said, that this is a rapidly evolving piece of work, and we're all working very hard on it, and we appreciate patience, particularly as the predictability of the vaccine supply is a challenge to scaling up and scaling down our access. But I wanted to say thank you to everyone who's participating. So I'm Simon Smith. I'm CEO of Clinica Family Health. Clinica has 5 clinic locations. We're in Boulder, Lafayette, Westminster, Thornton, and unincorporated Adams County at the intersection of 72nd and Pecos Street, south of 36. I would also just mention right off the bat that we offer full bilingual English-Spanish services at Clinica, and I think that can be really important information for our community members. Information about Clinica can be found at www.clinica.org. We have been working since late December on vaccinating both our frontline healthcare workforce, and then in close coordination with the county and with the state, supporting vaccination of the priority phased individuals. Particularly at Clinica with our current access and vaccine supplies, we have been doing outreach to our patients who are 70 plus years old, as well as those patients who fall into the 1A and 1B above the line categories. Beyond that, as our access capacity and vaccine supplies allow, we're working really closely with both Boulder and Broomfield counties, their public health departments, on outreach lists for community members in the 1A and 1B categories who are still seeking access to get vaccinated. Very similar to what Boulder Community Health shared, if you go to our website, www.clinica.org, we have a link for both patients and community members to sign up for our COVID-19 vaccine registry. This allows patients and other members to share information and express both what their profile is, whether they're a healthcare worker, their age, and their interest in either receiving a COVID-19 vaccine or receiving more information about the vaccine. This registry is really important because we are really focused on outreaching to patients and to community members as our access and as our vaccine supply allows. We strongly prefer that people interested in receiving the vaccine from Clinica reach us through that website wherever available rather than calling us. We have really strong concerns about call volumes really overwhelming our call center and our inability to answer all of those calls. So our strong preference is for folks who are seeking access to the COVID-19 vaccine, either existing Clinica family health patients or members of the community, to please visit our website and sign up for that vaccine registry. And then we are working judiciously through that list of people who are interested as that access and vaccine supply allows. We're really proud. Up to this point, we've vaccinated just around 1,300 patients and community members, primarily in the 70 plus year range, and are really excited to continue that work to support our community. Thank you.
Thank you, Simon. Appreciate it. And then I think King Supers, if you want to share. Are you on the line? Okay, Safeway. Okay, then let's see. Salud Family Health Centers, or actually SEL's comes before. No, Salud. Correct.
Hi, everyone. This is Jennifer Morris with Salud Family Health Centers. We have a clinic in Boulder County in Longmont, and we also operate 13 clinics throughout our system located in 7 counties. So we have a pretty big geographic footprint. I'd just like to echo what's been said before in terms of thanking the county for the great partnership. We really couldn't do this without you, from everything from planning on the amount of vaccine we're going to get to just the logistics of keeping our patients and community safe. So we really appreciate that partnership. First and foremost, of course, like everyone on this call, we're really excited about the COVID vaccine. We, first and foremost, are committed to making sure our underserved population have access. But it's a pandemic, and we really need to get everyone in the entire community vaccinated. And so if you go to, I'll talk through the registration process, but once you go to the registration process, it's anyone in the community. You do not need to be a SLUD patient. But we also appreciate our role of making sure the underserved population have access to the vaccine. So one of the things that it's been a learning process for us, just like any provider on this call, is balancing our staff resources for vaccine distribution while we continue to offer access to our patients for primary care services. That being said, we're certainly committed to providing the vaccine. We know this is the only way out of this pandemic, and but we want to be mindful that we're still providing ongoing care to patients. We still have people who are about to deliver a baby with prenatal care, have diabetes and need management, mental health, and so forth. So to date, total vaccines administered by the entire Salute system, that's been 6,277. For the Longmont Clinic specifically, 862 COVID vaccines to date. So internally, as we look at our patient population, we've been reaching out to patients both through using our care managers to reach out to those over 70 plus. We're also texting them. We also appreciate texting is not always the best tool for 70 plus, which is why we're using care managers so heavily, reaching out to this population. We're also working with some of our health partners in our community, mostly dentists, to see if we can help get them vaccinated. But just in terms of a general overview for receiving a vaccine, again, please visit our website instead of calling us. That's our preference. Our website is saluteclinic.org. If you open up the website, you'll notice a big, large orange button, COVID-19 vaccine. It has everything you'd want to know about getting a vaccine at Salute. We want to be mindful that many people may not have access to a computer or not technologically savvy, which is totally fine. We still want to get you vaccinated. So in which case, please do call us and just be patient to get in, because the phone line is pretty swamped. And that phone number is 303-MY-SALUTE. But again, if you can register online, please do that. Once you go to our website and go to that registration button, you'll be asked a few screening questions, because we really only want to put people in the registry who are over 70 or a healthcare worker. Once you go through those, we'll ask you which site you like to receive a vaccine, because again, Salute operates quite a few clinics. One thing to note is on our website, we're stating the current eligibility, so you can quickly determine if you're even eligible, so you don't have to go through the registration process and find out only that you're not. Once we have that registry similar to Clinica, we're reviewing that list, and we're going to follow up with the person to schedule an appointment. We're going to follow up either through a phone call, a text, or an email. The communication mode varies a little bit depending on how much vaccine we have. For the most part, it will be an email to schedule that appointment. We will only schedule appointments for the vaccine we have confirmed. We will not schedule appointments out based on what we think we're going to get, just given how the vaccine right now, the distribution isn't constant. So, we appreciate that. We don't know what we're going to have until that week. And we don't want to schedule appointments only to have to cancel them. Again, one thing we're looking at is hosting large-scale vaccine clinics once there's a more steady supply of vaccines. So that will be hopefully on the horizon soon, that we will either partner with other community partners or host ourselves. One thing, if you're interested in helping volunteer for some of those large-scale vaccination efforts with Salute, we have a volunteer COVID vaccine button on our website, again, saluteclinic.org. And you can go there and register whether you want to help with patient flow issues as a generalist, or you actually want to help be a vaccine administrator. So we've had a lot of retired folks in the community who want to help with this. And we would love help, because we definitely are going to need extra resources to do this, especially as the eligibility opens up and we have more people to vaccinate. And I think just finally, just continue to check our website for all these updates. We know this is all evolving information. I'll say it one more time, saluteclinic.org. Also, just check our Facebook site, because we are keeping updates there too. But we're really committed to providing vaccine to our community. Definitely excited to do this for the long haul.
Thank you, Jennifer. So helpful, so helpful. So I'm going to move to SEL Health now. If you'd like to pop on and give us some info.
Hi, my name's Kim Tate. I'm the Director of Pharmacy here at Good Samaritan Medical Center. And we are just thrilled to be vaccinating our 70 plus individuals in the community. I believe my peer, Kelly McGregor, has a slide to present, and she'll do that shortly. But we wanted you to know that individuals do not need to be an SEL patient to get the vaccine with us. And the best way to see the vaccine appointments and make an appointment is to create a MyChart account in our portal at mychart.selhealth.org. Other health systems do utilize MyChart too, but just to note, our website is mychart.selhealth.org. If you sign up for a MyChart account, the appointments will show up. If there's no appointments available, if they've all been taken, at that moment, I would encourage you to check back. We are evaluating our vaccine supply and releasing appointments each week. And when you go on, you will see buttons to select our sister sites as well. So St. Joseph Hospital in Denver and Lutheran Medical Center in Wheat Ridge. And so you can schedule appointments through that app. Also, starting next week, there will be an interest form available for individuals of all ages to put in their information, like age and risk factors and that sort of thing. And you'll go on to a list, and then based on the priority group, currently we're doing the 70 plus, there will be a selection, a random selection process, and someone will reach out and contact you to schedule the appointment. And so you can find that interest form on our SEL Health website at selhealth.org/COVID vaccine. So we are super excited, and we would invite you to sign up with us. Thank you.
Thank you very much. So I believe that Chad or Daniel has arrived from King Soopers. Daniel, do you want to?
Sorry about that. I had the wrong setup at first, but yes, you know, kind of echoing, I think everyone on here, we're definitely really excited to the Boulder community and get those shots in arms and get our people taken care of so we can kind of get back to a semblance of normalcy out there. So the way that we are trying to help everyone out, of course, is we have, the number is 8 King Soopers locations located in Louisville, Lafayette, Longmont, Boulder, and Boulder. So out of those locations, we have been having, of course, similar issues as getting vaccines actually into our stores. But we are working on that and are hoping to very soon get that, kind of like with the kind of document that you've been working on. Kind of at a point right now, we still don't have vaccine available, but it is coming soon. So as soon as the allocation gets to us, we'll be able to take care of as many people as we're able to. The way we have it set up is we have 2 ways, one of which is coming and will be launched soon, which is a phone number in addition to the website. Right now, mainly it is the website to go to, which is kingsoopers.com/COVID vaccine. And on the website, you'll be able to select a time slot, store location, date, time slot for your vaccination. The phone number we're getting implemented, and as soon as it's up and going, we will get that out to, so that way they can post that information as well. For some of those users that aren't really as technology savvy, so kind of just broadening our ability to make sure people know and how to get hold of us. But yeah, the best thing I could say is we have great pharmacists, and that's definitely one of the things they do very well is provide vaccinations for our communities. Definitely interested in trying to help with the county on any type of locations. So if we can kind of take our providers out there to these individuals that can't actually come out to our stores. So anything that we can always do for that, we're more than happy to try to help out. But yeah, as soon as we get those in, we'll get that information updated for you guys. And We've worked really close with everyone with the Boulder Health County on making sure they know kind of where we're at with everything. So as soon as we have it, we'll let everyone know, so that way they can come and we can get everyone in that 1A and 1B squared away as soon as we possibly can.
Thank you, Daniel. I think now we're, that concludes all of our guest speakers. I believe we're ready to start the Q&A section. Mike, do you want to run through the housekeeping again?
Absolutely. Good afternoon, everybody. I'm Mike Stratton with Boulder County Public Health. We'll now open up for questions. If you're on the Zoom screen, you'll see at the bottom Q&As. If you click on that, type your question in and we will read that out for you. If you're on the phone, you can raise your hand by hitting *9. We'll see that. We'll call on you. You can ask your question directly. *6 is how you unmute yourself. We ask that you keep your questions short and succinct so we can get to as many as possible. We'll say that everyone here is answering their questions from a place of respect. We ask that everyone do the same. We'd hate to have to mute anybody. Don't want to go down that road. We are focusing on vaccine questions today. If you have a different question or if we don't get to your question, you can send an email to healthinfo@bouldercounty.org. And lastly, joining us today, besides the folks you've already heard from, is Dr. Chris Urbina, Boulder County Public Health Medical Officer. So let's get to the questions. We've got quite a few already. The first one, some of you have touched on this already, but I may ask you to say again how people deal with this situation. The question is, I have a 96-year-old neighbor who wants to get vaccinated, but she does not have a computer or online access. Is there a way for me to sign her up? She did have a doctor, but that doctor has recently retired. So any of our providers want to say what they've got set up now for phone or other access?
I wonder if maybe I can just repeat what was said, that each provider is suggesting that you use the website if you can, but they do have a phone number available for folks to call. And we also, if you know an older adult who needs some help, we ask you to reach out and help them sign up, because it'll just be a smoother process for everybody. And if there's anyone else who wants to add anything, please do.
And I will add that on our vaccine page, we have recently added a list of providers. Some phone numbers are already there, and we will add those to that list as they all come online. Next question is for Dr. Urbina. A couple of questions about the more contagious variant of COVID-19. The first one is, what percentage of COVID-19 tests are showing up with the more communicable variant? Have we detected this in Boulder County, and how many? Second question is there a type or style of face covering that is more effective with this type of COVID-19?
Thank you, Mike. Chris Urbina here, Medical Director of Boulder County Public Health. These are great questions and commonly asked questions. When we talk about viruses in general, all viruses mutate. So it's not unusual that the COVID-19 has already mutated. Often these mutations are very small or slight, and so they don't really actually change the disease. As Jeff talked about earlier, this B117 variant has been shown in populations, particularly UK, that the more people that come in contact with, the more likely that more people who they come in contact with are getting the infection. And that's how we predict how contagious it is. The virus really is still the same particle. It either reproducing or producing more virus particles if you get infected, or it is stickier to your respiratory membranes. All of those studies are going on right now to determine how this infection is spreading. So right now we think it's just more population-based. It's also important to know that the current prevention strategies that we're using, the masks, and it doesn't matter which mask, because the virus is still spread the same way, respiratory droplets or aerosolization of the virus itself. So by you wearing a mask and the other people wearing masks around you, or physical distancing, not gathering in groups, washing your hands, disinfecting the surfaces, and limiting your contact with people outside your household, we believe that those prevention strategies will protect you, whether or not it's this virus variant or future virus variants. It's because it's going to change. The other thing we know about the variant is that our current treatments are effective, and the vaccines that are currently available are also effective. Now, all of those studies are still ongoing out because obviously the virus is changing, but the good news is the vaccines produce a immune response in your body that protects you from all COVID-19 viruses. That may change in the future, but that's the information that we have right now.
Thank you, Dr. Rubino. All right. This is going to probably depend totally on the provider, but the question is, can you sign up ahead of time if you're not in the 70 plus? I think most providers would say no, but are there any providers that are saying, please go ahead and sign up now and we'll take you when your time is up? Anybody?
So this is Jackie from Boulder Community Health. We would encourage anybody who is not quite eligible yet to get the vaccine to go ahead and set up a MyBCH account, even though they may not be able to set up an appointment yet. They should go ahead and sign up for the account. That'll be the way in which we would contact people that we know are interested in getting the vaccine through BCH.
Okay, thank you, Jackie. All right, this one's probably for Chris Campbell. Is there any restrictions on undocumented community members receiving the vaccine? Do they have to provide a social security number to get vaccinated?
Thank you for that question. Absolutely no restrictions. Any community member will be able to access the vaccine, and there's definitely no information around social security numbers collected.
Okay, thank you, Chris. This one I'll throw to Jeff. The question is, will the vaccine rollout affect the COVID dial restrictions and where we are on the dial, which is currently in the orange level?
So the dial, the way that it would affect the dials, if our numbers are reduced because more people have the vaccine and there's less chance for that to spread, then we are measured by 3 indicators on the dial. If our numbers decrease, if our hospitalizations decrease, and if our positivity stays down, and the vaccine will help with that, we would have to meet those indicators for 2 weeks before we could be moved to a lower level. So that's the way that it would impact the dial. As you probably saw from the governor's press conference last week, the state is also considering potential changes to the dial, but I don't have any insight on what those might look like at this point.
Okay, thank you, Jeff. This one's probably for Chris Campbell again. Is there a best practice for companies to sign up for their employees to get the vaccine, specifically for grocery and essential workers that are in the second half of 1B? Thank you.
Yeah, another great question. I appreciate that. I think that certainly that group, as we start to move into larger community members, frontline essential workers, we do want to partner with companies. I wouldn't say there's a best practice yet, other than attending these forums. We are connecting with community members and employers to inform our plan. And again, our goal is to provide as many providers as possible and a clear kind of a clear line to those providers. So I don't think we can answer for the community members yet on that, and do know we are looking at those phases in a number of ways because it's such a large group. We want to ensure that we remove any barriers possible. So if a provider is set up well and we're able to work with them to provide vaccine to a large amount of frontline essential workers, we're going to go that route. I think you've heard from the provider group here today that we're all willing to help and step in and be creative with various types of reaching out with strike teams, doing pop-up clinics in the community, along with the settings that we have, the clinics through the hospitals and our the federally qualified health centers in the community, along with the pharmacies. So our goal as we move in those phases is to have a lot of options out there and clear public information for everyone, and really making it a partnership with employers as well.
Okay, thank you, Chris. This is what is for our King Soopers and Safeway providers. Question is, will you be vaccinating your staff before the public? How is that going to work?
Well, kind of like we talked about before with, or Chris did with the frontline grocery workers, we kind of have to see how that turns out. But our pharmacists and pharmacy technicians are in that 1A, 1B grouping. So they are part of taking care of those individuals, those healthcare workers in that area. So we do look to try to get them taken care of, as well as anyone else in the 1A, 1B, of course. But as far as the rest of what you would consider staff for the stores, of course, we have to wait for more information and more, I guess it's more time for us to get to those phases for those individuals. At least as far as what King Soopers does. Like I said, we definitely take care of anyone in that 1A, 1B, and that does include some of our pharmacists and technicians.
Okay, thank you, Daniel. Dr. Urbina, this one is for you. There's been reports in the media about a supply interruption for the Moderna and Pfizer vaccines. If that does happen, and you might talk about if you think that's a possibility, what is a maximum amount of time in weeks or days that either of the vaccines can have between their first and second shots? We know that Pfizer is usually 3 weeks, Moderna is 4 weeks, but if it needs to stretch out, is that possible, and how does that work?
Great question. I always appreciate these questions because I think that people are curious, and that's very valuable to get this information out. The clinical trials were done in the stages. Pfizer 3 weeks between doses, Moderna 4 weeks between doses. Those were where they showed the maximum effectiveness. Now, both Pfizer and Moderna have said, well, there's probably a grace period that you can give it maybe as early as 4 days earlier, but to get the maximum benefit, you shouldn't do it much earlier than those 2 times. The outward, how long after that first dose is unknown. Right now, they're continuing to watch these clinical trials so that they're watching these people that have had the previous vaccines and watching to see how long it's protective. But there's no maximum timing after the first vaccine because it just hasn't been studied yet. But we'll know more in the future. So I think if there is an interruption, and I can't comment on that because I have not seen the CNN report, but it's likely that with the new administration, they're going to put a lot of resources into developing further vaccines. So we're all hopeful that the demand out there is going to be done, because obviously all the vaccine companies want to produce more vaccine, and hopefully the federal government will launch those resources to help 24/7 development of that. But there's no outline time to get your second dose. We obviously want you to be as covered as possible. That's just how vaccines are developed.
Thank you, Dr. Urbina. I've got a question here for Chris Campbell. Is there a charge for the vaccine or an administration charge?
Thank you, Mike. And some of the providers can speak to this. So certainly in order to just even cover some of the administrative cost and overhead for our providers, they are able to charge insurance. And I believe it's a $23 charge to insurance administrative fee. So likely with some of these providers, they will ask for insurance. Anyone that is uninsured will not have to pay. It is a free vaccine to everyone, and you will not be asked up front to pay anything if you're insured or uninsured. My understanding is that providers are then reimbursed for anyone that is unable to pay. So you will not be turned away. You potentially, again, will be asked for insurance. And again, those that are uninsured will not be turned away and will not be asked to pay anything up front.
Thank you, Chris. All right, we have one last question here. It's for BCH. It says, we are 78 years old. You've been signed up with BCH for 2 weeks. How do you decide when you will call us for an appointment?
Thank you for that question. If you have signed up with my BCH, you should be getting, if you are 70 and older, so that's the other piece, it looks like you are, you will likely have even gotten an invite even as late as today. But if you have not, I would ask you to call the COVID hotline that is on our website and call that number and say that you do have an account, but have not yet been called to get an appointment. That would come through my BCH app. So if you haven't checked your app today, to look at that to see if you have a message to schedule.
Thank you, Jackie. All right, we have one last one before we're going to wrap up here. Can visitors in the state from other states or countries get the vaccine in Colorado? That's probably a Chris Campbell question.
Yeah, that's another good question. And again, our whole goal is to vaccinate as many community members and as many folks as possible. So we are trying to remove barriers. I think the thing that's challenging, and you'll keep in mind, many of these providers you sign up with, you're committed to coming back for your second dose. So again, it's likely you're not going to get turned away, and there's not a lot of questions there. Again, our whole goal is to vaccinate as many people as possible, and you're going to experience that when you sign up to get vaccinated. As long as you're meeting the phasing and in the right place, then you'll get vaccinated.
Thank you, Chris. We've had one more pop up, actually. This may be for the providers, but Chris may have an answer too. You've indicated that most providers are scheduling about a week out. If your weekly allocation is short, do you cancel the second shot routine or the first shot routine? In other words, are you postponing first shots in order to fill the second shot appointments? Anybody want to respond? One of our providers?
Simon, I see you shaking your head.
Yeah, I would just say, that just speaking from a provider perspective, this is part of the weekly scheduling challenge that we're all facing, which is the balance of how many vaccine doses we're getting in a week and the balance of scheduling those second dosings. As Dr. Urbina said, there's good, strong evidence of a timing perspective. We're sticking strongly to the fidelity of that timing perspective on the second dosing. So on a weekly basis, at least at Clinica, we're looking at our available vaccine supply. We're certainly prioritizing making sure that the second dosing is done on time, and we're balancing the schedule on a weekly basis between those coming due for their second dose and the availability to administer first dosing. And as we continue to roll forward, we have a better sense in the weeks to come of who is coming due for that second dose.
Thank you, Simon. And with that, we're at the end of our questions. I'm going to turn things over to Jeff Zayak, who has a few words to wrap things up today. Jeff?
Well, thanks, Mike. And I want to thank first, again, our providers who are on the phone with us today. I appreciate the kudos to Boulder County Public Health, but we also need to provide kudos to you. We could not do this without you. This is definitely a partnership, and it's critically important, so thank you all. I wanted to touch on one other thing that's become a pretty big question for us, and I know not everybody's aware of it, but people are often thinking that they don't have to wear masks after they're vaccinated. And the reason that masks are still required after vaccine, and I know nobody likes to hear this, I certainly don't like to hear it either, but it's going to be really important that people continue to wear masks until we have most people vaccinated in the community. Just again, 95% effective, not 100%, but we still have a lot of people who can spread the disease to other people. And until we get a larger portion of our community vaccinated, which probably won't be until the end of the summer, the early part of the fall, we'll need to continue to wear masks. The state will at some point make a decision on when masks are no longer necessary, but we need you to continue to please wear masks after you've been vaccinated. So I wanted to make sure folks are aware of that. And finally, I just wanted to say thank you to everybody for tuning in. we'll continue to do these weekly, and we look forward to seeing everyone next week. And again, thanks to our providers who are on the phone. Much appreciated. Have a good afternoon.